Well, hello. You're looking at the beautiful face of Karen Kaufman. This is Dr. Gary Huber. I am with you as well, but we're going to keep the attention on Karen today. This is a talk that I have promised my patients literally for years, at least 2 years. And because we have videos, we have articles on estrogen and women and hormones and all that good stuff, but I didn't have anything on testosterone. And I couldn't think of a better person to have this conversation with than my dear friend Karen, who is a delight. And Karen is out in Colorado. We were just chatting about her background and went to Case Western Reserve in Cleveland, then off to Chicago for residency in OB-GYN at Northwestern. And then she picks up and goes, all right, time to get business underway, and moves all the way to Colorado because she just loves that area. And you've been there for how many years now?
20 years.
20 years.
I'm almost a native now.
Are you in Boulder or are you in Louisville?
I'm right outside of Boulder in Boulder County. It's called Louisville, but it's right outside of Boulder. So we're still in Boulder County. We're halfway between Denver and Boulder. And so it's a great place for us. Yeah.
Notice you called it Louisville and I called it Louisville because
Well, you're near Kentucky. You would.
I am near the real Louisville. Anyway,
Yeah.
you and I have chatted about having this conversation for a while. And I'm really excited because I've got a couple of objectives that I want to get out of today. And I'm going to let Karen be the expert here. She's the OB-GYN. Karen was, like myself, seeing patients and realizing the limitation of traditional medicine. It has great benefit, but has a lot of limitations. And as you said to me, your patients, some are doing okay, but a lot of people are getting traditional care and just not feeling great. And that's what kind of drove you to be more integrative, right? What was that journey about?
Well, I started feeling like I wasn't able to have answers to people's questions. And the questions that I was answering were things like, I'm tired, I don't feel so good, my metabolism is slowed. Why am I waking up brain foggy? Is this, and the answer that many people get, if people haven't experienced it already, is, well, you're getting older, it's normal. And I just felt like that there had to be more. And so my eyes just got opened wide open when I started studying integrative functional medicine and offering ways to help people. And really, I'm going to give a little backstory because I tell my patients this all the time. I think part of it is that physicians learn diseases and how to treat diseases with pharmaceuticals. We don't really learn about states of health, wellness. So I feel like part of aging is the wellness factor that we just don't have a label for. And so we need other tools in the toolbox.
We absolutely do. As you were, and this is important, I think, for every patient who's ever heard the word hormone, you're an OB-GYN. How much did you learn in your residency training at the renowned Northwestern University in Chicago? How much did you learn about the use of actual hormones, not drugs?
Zero. And I say that all the time, and it's zero. And that's why, people don't know what they don't know. Physicians don't know what they don't know. It's not totally their fault. So I never say like, oh, we could be, it's just not part of what you study or learn about. And again, I go back to, it's a state of health. It's not a disease, it's a state of health. And while hormones naturally decline, that's not your best health.
Yeah, I always tell my patients, look, your doctor's awesome, but he or she was traditionally trained and was never given the opportunity to understand the benefit of hormones. So with that said, Dr. Kaufman, tell me a little bit about this. These are your slides. I'm going to click the button for you and move you through, but tell me a little bit about what are we talking about today?
Okay, well, first I want to thank you for having me because, as you know, I'm a huge Dr. Huber fan, as probably everybody is. But I would say that I'm so passionate about this particular topic. I think partly because there were so many years where I wasn't able to have the tools to help people. And now I feel like there really is. So we're going to launch in and talk about one hormone in particular today that is called testosterone. And many of you are aware of it. You've heard of it. Maybe you thought it was only for men. Maybe you think that's a male hormone, if we're even using, the assignments of gender anymore.
Are we allowed
But
to?
yeah, if I'm allowed to, but I will say that it is really for women as well. And it's been a huge mystery to many, many people. So we want to unfold that mystery today.
So the graph that I have there in the lower left-hand corner, it just shows you over time, a woman's age, when she's a teenager, 20s, 30s, 40s, this is her estrogen production. And notice what happens at age 50, right? It goes absolutely down because she's in menopause. But look at her testosterone production your whole life. And even after menopause, you're supposed to have testosterone. And I'm sure you and I will talk about women, and we test them, and their testosterone is unmeasurable. And that to me is scary because testosterone has a huge impact on our health. And we're going to get into that. So,
And
what is testosterone? Go ahead, Karen.
Yep, and I just want to say also that there are many, many times, and probably people who are listening to this have noticed this, that you may have a lab that says you're in the quote unquote normal range. That's really not based on optimal health. So there are many times where women don't totally believe or know that their testosterone is low. There are times it's low and marked and flagged as low on the lab, but not always. And yet the range that we use isn't optimal.
Do you feel that a 50, 55, 60-year-old woman should have testosterone levels that are akin or close to a 25-year-old?
I think so.
I do too.
I think so, because it's not just the spirit of what people are labeling anti-aging, and people will say, well, isn't it natural? Isn't it normal to be depleted of your hormones, including testosterone? And the answer is it's common, and it is can be considered normal, but it's not optimal health. And getting back to the fact that women, I say this slightly in jest, but women really weren't meant to live much past menopause. And here we are spending we've got 40, 50 years past menopause. How are we going to live out those years with vitality and energy and quality of life?
I agree. And I take it a step further to tell them, look, if you're a giraffe and you can't make babies anymore, you're not long for the herd. I mean, when you look at nature, once you can't replicate, your life expectancy is very short. And as you pointed out, we're living another 30, 40 years beyond our replicative years. And so again, it's exactly that. Yes, it's natural, but it's by means healthy. So go ahead. You've got down that this is one of the major hormones.
Okay, so testosterone, as you saw from Dr. Huber's graph, is actually produced more than estrogen. And that's often hard for people to believe because we are so used to hearing the word estrogen, and it's part of our female nature and it's part of our vitality. And when we lose that, we lose some things, and that has its own symptoms associated with. But testosterone, while classically considered a male hormone or in the category of androgen, is actually a very important part to many, many things in our health, which we'll be going over. So kind of as we alluded to, women actually make more testosterone than they do estrogen. And that is really hard sometimes for people to wrap their head around. But where does it come from? Our ovaries, of course, make those vital sex hormones, but also our adrenal glands, which is sort of our get up and go, our fight or flight, our physical and mental resiliency is our adrenal glands. And so it comes from there too. So over time, as life would have it, not only do our ovaries stop producing as much, but our adrenal glands get a little bit, it's tired, might be a bit no longer used in that terminology, but dysfunctional, where we're not even able to get that from our adrenal glands that we used to because of the stressors and life that we're dealing with day to day.
Yeah, those stressors, because testosterone should not drop off a cliff at menopause like estrogen does. It should carry on. It's a soldier forward, because we can make it from our adrenals unless we've been stressed out of our minds and we're, a victim of the clock and all of our egoic elements. So the imbalance starts early in life.
Yeah, and it starts actually at age 35, which is really hard for people to believe because people will say, am I perimenopausal? Am I menopausal? Like, where am I? And it's hard to believe that even at 35, even if you hadn't finished your childbearing, things start fluctuating and changing. And so testosterone drops off. And then, as Dr. Huber said, you'd think maybe the adrenal glands could carry the day, but it's not even like, even if you said my quality of life is good, I really don't have that many external stressors. The pace at which we're running in this day and age is just stressful, period.
Is in your mind, just share with folks this idea of am I menopausal? Am I not menopausal? And they think it's a black line and they step over it on a Thursday. Can you just speak to that?
So perimenopause is actually the 10 years around menopause. So we don't know when that's going to start for somebody, but you can kind of couch it as, okay, 10 years prior and even up to 10 years after. Menopause is the one thing that does have a clear definition, which is 12 months without a period. That means that you could be 7 months without a period and then all of a sudden you get one. And does the clock restart? It's hard to know, but it's 1 year without a period where you're menopausal, and all the rest counts as perimenopause. So it's associated with many, many symptoms that people experience and don't always have an answer for, which is why sometimes primary cares will say, you know what, maybe you need an antidepressant, but actually it's hormonal changes.
Yeah, antidepressants, that's a common here's your Prozac. Just get used to it. You're getting older. So if a woman comes in and let's say she's skipping cycles and she's, 48, 49, and maybe she's only having 3 to 4 cycles a year, sometimes her belief is, well, I can't start doing anything with hormones until I've gone a full year without a cycle.
That's a great point. You can start influencing hormone balance as early as really at any age. You can start influencing the way the cycle works. If there's imbalances, things like heavy periods, crampy periods, irregular periods, things that you think, oh, I just have to wait this out. And the waiting it out actually brings on a lot of symptoms. And it can be influenced with both lifestyle, supplements, sometimes prescribed prescriptions, but it sometimes takes a combination of everything.
Yeah. So your last point there.
So my last point is really what we've kind of been talking about, which is it is normal to have hormonal decline. That doesn't mean it's optimal aging. And again, I go back to our life expectancy is so long. So not only how are we going to have lifespan with the number of years we have, but how do we have health span and quality of life and in a safe way?
Yeah, absolutely. So some of the there are a lot of different symptoms, and we'll talk about in the next slide a lot of the different symptoms. But beyond just symptoms, there's actually clinical problems that the body incurs when it doesn't have testosterone.
So I put this here kind of to be a visual because I just think it works a lot better than listing off all these things and talking too much about it. But truly, when you look at androgen deficiency, which is at the center, which in our minds, we're going to say testosterone and a little bit of DHEA, which maybe you all know about from Dr. Huber, but we're going to mostly focus on testosterone today. But everything from loss of lean muscle to sexual dysfunction, including, which we'll get to a whole list, bone density, brain influence. So people feel sharper, they feel less foggy when they use testosterone. We'll get into those details. Changes in the way your body hair is. Maybe all of a sudden you're losing hair on your legs and increased abdominal fat. That's very common as well.
Belly fat? Did you say belly fat? I mean, these are critical issues, right? Think of it. I don't know any woman who, as she's approaching 50 or past 50, approaching 60, isn't concerned about my brain. I don't want to get Alzheimer's. My mom had Alzheimer's. I don't want to get fat, right? I am worried about my belly fat. And just the fact that she feels like her muscles are just not as strong, not as capable. And muscles are a warehouse that our body has where we store resources. We store minerals. We store fluid. We store amino acids in our muscles. And when we don't have them, that directly correlates with longevity. The less muscle mass you have is going to predict your longevity to some degree. It's one of the factors that goes in. So
Yeah, and I would add to that that this is the beauty of the integrative approach, which is you start to realize that it's not just that center androgen deficiency on its own and isolated. It is connected to every single organ, including the ones that are so valuable as you age, like you said, your brains, your bones, your heart. That's really the critical piece.
Yeah, I think this is a key takeaway from today because a lot of women would say, well, I don't need testosterone. I'm a woman and I feel fine and I don't want to, everything's good. And I don't know that everybody, and why would they, truly appreciate the depth to which testosterone impacts us. And being an old ER doc, I'm always looking at the heart. And I know that testosterone is central to our cardiovascular health and our blood sugar control. So I just want people walking away from this understanding, wow, it's really, really broad, the impact that this has. And if we looked at the symptoms individually, I'm going to flash them up here.
Yeah, let's talk about each one because they each have their own importance, and some of them people may feel like, well, this is more fluff, but not really. We're looking at real health issues as well as the quality of life, and it's that magical combination that make people feel vital and alive and well during their second half of life. So one of the first things that comes up is low mood, and I hear it really all the time. I'd say about 90% of my patients are women. I do treat men also with the integrative approach, but mostly it's women. And there's a lot of loss of motivation. I used to love going to the gym. I just can't get myself there anymore. I don't know why. Or just real apathy, flatness, meh. People say, I feel meh, and even depression. And actually, when we say low mood, I don't know if it's on my list, so I'll include it here, but feeling anxious.
Throw a few of these up here and just got
Thanks.
a few lines to work from.
Okay, great. Thank you. So feeling, people will say, I feel anxious actually, and we're going to get to this more, but testosterone is like an emotional shield for women. It's funny when it goes down, sometimes there can be more depression and more anxiety. The low libido is very real. Now, there are a lot of reasons for low libido. It is one of the physiologic reasons for low libido. But of course, when we're in long-term relationships and we have communication issues, I mean, there's not enough testosterone in the world to override that. And I tell my patients that all the time, but as far as giving you a little bit of true interest and sexual response, people will say, I don't know what's happened. I've lost my orgasm, and testosterone can aid in that. The loss of motivation I spoke about, it's a flatness. It's people not doing that. They're things they used to find joy in, all of a sudden don't drive them anymore. And people feel a little bit lost about that. I will say headaches. Oh, I've seen really amazing things turn around. I have several women who come to me specifically. They know when their testosterone needs to be adjusted because their migraines come back. So it's not the only reason for migraines. It's sort of, as you all probably know, there's a lot of reasons for everything, but it is definitely something. Bone thinning. One of the things that happens as women age is we lose our bone density. And that can also be from many, many things. It's estrogen, it's progesterone, it's testosterone. But if women are only replacing with estrogen and progesterone because they think those are female hormones, we're missing a big piece of it.
I think that, what you look at any of these symptoms and you've already pointed out, testosterone is not the only reason for it. And so, but it's so common if somebody has a lot of these different complaints. I always start with, okay, well, let's just build our base. If your testosterone is low, we don't know that that's the cause, but we certainly know that if we get it normal, as you pointed out, we physiologically have given you the capacity to not have that issue. And then sometimes we just see some of these things melt away, right? All we did was restore normal balance. We didn't treat headaches per se, but they kind of melt away as we get your base hormonal plateau in a good balanced position.
Absolutely. And to speak about the osteoporosis, I have seen people, this is clinically now, of course, there's plenty of data to support this, but just clinically, my patients have gone from osteoporosis to osteopenia from some minimal hormone interventions.
I agree. I've seen that. And I tell my patients when they come in and so osteopenia is just the milder version before it becomes full-blown osteoporosis. It's bone loss. And I tell them, I can't guarantee you this, but it's common that we see your DEXA scan actually improve over the course of time. Whereas left unattended, we would expect it to continue to drop year by year by year. So it's a big one. The
Yeah,
cognition issues are big, the
the
energy.
yeah, the cognition issues, many people say that the testosterone cleared their brain fog. They're thinking more clearly. They feel like their old self again. They didn't even know. In fact, many people will tell me they didn't even realize they were struggling until they noticed the positive changes. So I would say that is very profound for many people as we age. And the energy, energy again, kind of like Dr. Huber always talks about, is multifactorial. But in this situation, for many people, it keeps their afternoon crash down. They feel a little more physically resilient. They're not falling, on their face after work. And that also impacts mood. So it's all very circular.
Doesn't it though? I mean, if you don't have good energy, everything in your life is just, as you said, meh. I don't even want to be there. I don't want to participate. And when we look at energy, it's got to be one of the most common complaints I hear every stinking day. I don't have good energy. And I always go directly to, well, how is your sleep? And we're so bad at respecting our sleep. But then I talk about the 5 different energy producers in our body, one of which is hormone. Hormone is a big energy producer. Cortisol, adrenal, sleep, and gut. And you and I address those things. So I don't want to present the idea that if you have low energy, it's just low testosterone. But you and I know it's a big piece of that puzzle.
It's helpful, kind of like everything. We have to address all those pillars that affect our health, and then we can layer on other things that are going to get us to a new exciting place. Muscle wasting, if you haven't heard this or seen it yourselves, I mean, I every single woman over 40 will come in and say, I'm working out. I just can't maintain my lean muscle. I don't know. I'm trying to do the best I can. And some of that is true physiologic muscle wasting. And muscle wasting is actually really linked to our longevity. So there is real health implications in losing your lean muscle.
And that's being shown more and more in studies that one of the keys to longevity is maintaining muscle and bone mass. And we've got to exercise to do that. But if we don't have the hormones to help us recover, then a lot of people, okay, look, I don't have the energy to exercise. So it kind of, it's a circular logic there.
Yeah, you've got
And
to
then
promise.
lastly, there can be some very personal issues related to low testosterone.
Yeah, I think, I mentioned the emotional swings. That's kind of goes into the low mood and the anxiety, but also this idea that we get this shield of, people will even say, confidence with testosterone. And the final thing is definitely related to the vaginal dryness and weak bladder, which so many of us experience, whether it's because we had babies or we're menopausal. But there is a role for testosterone. There are testosterone and estrogen receptors in the vaginal tissue, and it can really change things for the better.
Stress incontinence and the use of testosterone. Speak to that if you would, just about how your approach is.
Well, a lot of times when we talk about just bladder and vaginal health, it's local vaginal application of these things in order to reach the bladder and the vagina most effectively. And we do have receptors and we have smooth muscle in our bladder. And so we need to support that, just like we have to support every tissue in our body. It's the same thing. It gets weaker, and then this really provides some stability.
Yeah, I find that an amazing treatment when I give a woman a vaginal suppository testosterone and her stress incontinence either completely abates or dramatically improves. It's just my quality of life is better.
Yes.
All right. So here's the fun part. Myths. This is garbage thinking.
Okay. Well, this is exciting because many people will hear this, and especially from their primary cares. I feel like a lot of probably what you see in Dr. Huber as well is we're approaching things differently and answering questions differently than your regular provider. And people will actually say to their patients, you don't need testosterone. Women don't need testosterone. And actually, as we showed you, it's a very more produced than estrogen. So it's not just a male hormone. Men do have higher levels. Women need a little bit too.
All right.
And many people think testosterone causes aggression. And what I was trying to share with you on the previous slides is that it's actually mood stability. So it sort of takes off the edges of depression and anxiety, gives a little confidence. And so the idea is that you actually get that benefit without. Now, if something is if you do have a side effect of some kind, both Dr. Huber and I can handle all of those things. And of course, nobody is without any side effect at all, but that's something that we talk about. But in the most part, it helps mood, anxiety, even PMS in the premenopausal woman. And that's something that patients often think, like Dr. Huber was saying earlier, is I don't need hormone replacement until I'm done having periods. And that just isn't the truth.
I think that idea that it causes aggression it's born out of guys abusing testosterone and going into steroid rage. We've heard about these cases. That's not balanced use of testosterone. That's abuse of testosterone. So even in guys are not that different from women when it comes to our hormones. If they're too high or too low, yeah, we get crabby. We get, can be aggressive, but that's not good care. That's abusive and too much, heavy dosing. And
yeah.
then,
I'm sorry, go ahead.
I was just going to say, so this, I think, is one of the biggest ones. Breast cancer. My goodness, those two words strike fear in a lot of women.
Yes, this is actually something that is really hot for this has really been shown in studies over and over again that testosterone actually decreases the risk for breast cancer. And that's a really hard concept to get people's head wrapped around, because we're told, you just get breast cancer, you just have breast cancer, but that's actually not true. There's so many triggers for someone getting a cancer of any kind. But when we talk about breast cancer and one in 7 women getting a breast cancer, most women want to do whatever they can to minimize their personal risk. And testosterone therapy has been shown, when both used in the body and also directly into a breast cancer, reducing the size and risk for breast cancer. And in women who have had breast cancer, we didn't get into this, Gary, but when women have had breast cancer, it actually reduces your risk for recurrence as well. So it's not off the table that you could not use testosterone. In fact, it's encouraged.
And you bring up the recurrence. Testosterone in studies has been shown to be more effective than tamoxifen at blocking recurrence of breast cancer. And it's interesting because, again, look, we love our colleagues, but we understand there's some lack of education. And a lot of our oncologists, our breast surgeons, or OB-GYNs, they don't understand this. They don't read this. And I contact OB-GYNs and oncologists directly and ask them straight up, are you familiar with the research on testosterone and Dr. Glazer's work in this area? And I usually get, the tilted head Cocker Spaniel, whoo, and they have no knowledge of it. And that's unfortunate. One of the really good things I wanted to come out of this conversation with you today is that understanding that it is so definitively clear that testosterone reduces the risk of breast cancer. And in fact, we've used it in our office as treatment of breast cancer. And I'll share a case with you later on here. So that needs to resonate. And I've got the expert, Dr. Kaufman, here shaking her head in agreement that that's a true thing. So now it's true. All right.
Yeah. And I'm just going to give we don't ever want to give too much personal information, but I did have breast cancer in 2019. And I really rely on my testosterone to not only reduce my risk for recurrence, but also provide me with a lot of the resiliency that I feel from it that I wouldn't otherwise have.
And that makes you an even keener expert. There's nothing better than walking through the fires yourself to really force you to dig into the literature and know with certainty. So that's why I really, really respect your opinion here. You suggested these ideas as natural ways to produce more testosterone, and I agree with every single one of them, but you want to run through that list briefly?
Yes. Okay. So people will say, I don't really want to use anything. I don't want to take anything. I just want to, what can I do naturally? There are some things, and you'll notice a lot of these things are the pillars of our entire health. I'd say that clinically, I don't see people come back and say, wow, that's amazing. However, it helps a little bit. Everything we do, we can't just smear on hormones. And Dr. Huber and I talk about this a lot. We can't just layer on something when sleep isn't right and diet isn't right and exercise isn't right. So it's all additive. But truthfully, if you do exercise and lift weights with resistance training, it does promote some testosterone increase. And as we've all kind of been taught more and more, eating protein at every meal, 20 to 30 grams at every meal, and making sure the food you choose are full of nutrients and not, a similar 100-calorie Oreo snack is not the same as 100 calories of broccoli. And the protein is very valuable. Minimizing stress, I think we all probably talk about that every single day, and we're not just, even if we don't quote unquote have stress, the pace at which we're running, the phone calls that we make, the things we do are adding up and taking its toll. So the stress is a breakdown state in our body. Stress will break down not just our bones, but our muscles and our body as well. So when you minimize stress, you are retaining your body's natural ability to maintain itself.
I want to pause right there for a second, because most people, when we talk about this, they go, yeah, well, I binge watch Netflix every night. That's my kickback. I'm chilling out. That's my relaxation. It's not. That is not the way that we reduce stress necessarily. And understanding that we all incur our own stress based on our own interpretation of the day's events. I think that's under stress, our body does not want to generate hormones. It wants to stay alive. So if I'm incurring a ton of stress, the body is going to prioritize glucose and cortisol, and it's going to downregulate hormones, and it's going to downregulate thyroid. So you and I can sit here and yammer on about this all day long, but the patients are always stuck with, well, how do I change it? And again, I like meditation and stillness. I think exercise. What are your favorite, or what do you hand off to your patients as, look, this is how you mitigate your stress?
I recommend some very simple box breathing. It's about 2 to 3 minutes a couple times a day. And I tell people you can do it in the car at a stoplight. It's not that you have to designate all this time, but it's basically belly breathing, where you're in through your nose, expanding your belly really as fat as you can and holding it there for a few seconds, and then letting that air out, bringing your belly button to your spine for a few seconds. So it's an in breath for 4, hold it for 4, an out breath for 4, and hold that for 4. And it really does manage the stress response. And then I really have been moving people towards a gratitude journal, because there's been a lot of studies showing that having genuine gratitude in your life will minimize your stress and improve your outlook.
I agree. The interesting thing about gratitude, and I tell patients to do that, we human beings are really bad about jumping into the past and lamenting things that we can't change, or jumping into the future with what if. And the act of gratitude, as you point out in studies, forces you to come into this present moment right now. And that's really key. Plastics, we know, are just absolutely garbage and problematic. Alcohol, we all enjoy a little wine or something, but we just have to watch our intake of that. All right, I want to get to some really good stuff here. So talk about the options. A lady comes in to you and says, hey, I'm at this stage. How do you like to approach it?
Okay, there are several options, and everything is really personalized. You have to remember or know that the FDA does not recognize testosterone replacement as a therapy in women. So you can't just go to the Walgreens and get something natural and plant-based, which is what we all prefer. We want something that is going to be bioidentical, which means it matches what your ovaries and adrenal glands have made through the years that is no longer being produced. And mostly the only way to get that is through compounding, which means making it for you special. But there are different ways, there's different modalities in which you can get testosterone. And depending on your personal goals, what your starting number is, how you really feel, Dr. Huber and myself would recommend something in particular, but something very simple to start out with. It's like is a topical cream that you apply daily. It's a nice way to start, because you can see how you feel after 2 to 4 weeks. The dosage can be adjusted. It can be lowered. It can be raised. And I would say that some people, that's all they need and they feel really good. I think it's the most mild way to start, but it's a really respectable way to start and a good option for people who maybe feel a little bit gun shy about it or nervous in any way and want to see what might happen and how they would feel.
And you've got injections and pellets, but I want to make clear the testosterone in each of these three options is identical. The same testosterone in the cream is the same stuff that's in the pellets. It's the same stuff. These are just different ways of getting it into the body.
Yes, different ways to get it in, but some I think give a more profound response than others. And that's something that often I'll grow into with my patients. Maybe they start with a cream, we see how they do, and then we grow into the home injections. Or if you're familiar with pellets, I know Dr. Huber does pellets and so do I, but they are a little size of a grain of rice plant-based product that is natural and bioidentical that gets implanted into the buttocks of the fat tissue of the buttocks, not in. Some people have actually thought that I put them in the rectum. That's not how they go. They go into the fat tissue, but it's a very small paper cut incision, and that pellet lives there for about 4 months and dissolves over time. It gives people a really robust response where their numbers stay up and then they start to kind of go down. And truth be told, there's probably some variability in there, but it tends to give a really robust response if creams weren't really working that well or you're not interested in creams. And also it's kind of nice to go into the office once every 4 months. Dr. Huber does it, and then that's it. You don't have to think much about it. Home injections for me are a middle ground. It's like people who maybe they don't really want the cream. It's messy. It's not even that messy really, but they don't like it as much. And home injections, but they're not ready for the pellet where they feel a little loss of control because it stays in there for 4 months. Injections are a nice way that the dosage can be adjusted. You can actually increase, decrease, stop it, whatever you want. It's once a week in the belly fat at home. And it's a very simple injection to do if that was something like I call it the middle zone.
Yeah, I like that terminology. It is a middle zone. And I tell patients, you're not married to any of this. You can go back and forth. You can try a pellet. Oh, I didn't like it. I want to do this or the other. So it's not like when you choose one of these, you're married to it for life. But there's a lot of flexibility in those options. All right. So the worrisome, fearful, oh my God, what's going to happen if something goes wrong?
Okay, so that is always, what are my side effects? And I think both Dr. Huber and I have been humbled over the years to know that the idea is start low, go slow. Nobody wants to feel too much of anything. It's nice to get a small benefit and feel like you want to keep going with that. So that's always the approach. And then there's always going to be some side effects. I can tell you that some people really notice that the hair growth a little bit over the top, not that anyone else might notice, but like I can say personally, I'll notice it in the mirror, and I personally get waxed every 3 weeks, but I'll never give up my testosterone. So this is what I have to do. And that is fine with me. And so you can tweeze, you can do laser hair removal, which really takes it away. And not everyone gets this side effect, but it's a side effect that's a possibility. And hopefully, like so many things, the pros outweigh any of the minimal side effects you might get. As you are increasing your testosterone, when we're going from being negligible, maybe it's zero, maybe it's barely noticeable, it's almost like I won't say like puberty, you're not going to get a full breakout, but people will notice a pimple or two as their hormones are rising again. They're experiencing that transition, but it's not something that continues. It's usually just as it's going up and as things get stabilized, that doesn't really seem to be a persistent problem. I don't know if you feel that way, Dr. Huber.
Yeah, I don't see acne being, and again, I really think it comes down to dose. And as you and I are in an agreement, we start low and gradually build it up. I think those problems emerge far more commonly when the doses are really high. And there are clinics out there or practitioners that maybe aren't well-rounded, as Dr. Kaufman's practice is, that their whole practice is just slamming high doses of testosterone. Those kind of practices make me nervous because they're not looking at the whole health of the individual. You got these low T clinics that just think everybody on the planet needs a huge dose. That's when I tend to see acne and hair growth. And speak to this a little bit. There's a difference between the little white villus hairs and the really dark hairs. And
There is, and we're going to get to that some of the side effects, and maybe that's the next slide, but there is, it's sort of this dichotomy of, we tend to lose hair as we age, but then why do sometimes we get coarse hair, or even sort of a hair thinning at the scalp? And so that speaks to this next slide, which it looks a little busy, but basically, if you look at the bottom, the testosterone, and I don't know if there's a cursor to put over that, but if hopefully everyone sees the
over
testosterone.
here,
Yeah. And then there's a couple of ways the testosterone can go, and not everybody does this in their body, but testosterone can be converted to something called dihydrotestosterone, that DHT in the lower left. That tends to help make people thin a little bit of hair and get the more coarse hairs. So there are supplements, there are ways, sometimes it's dose dependent. As Dr. Huber said, we're cautious and trying to reduce any side effects, but there are ways to manipulate that from our perspective, if that were to happen.
So we can do things to kind of arrest this 5-alpha reductase activity so that testosterone doesn't go that way. And some of the classic things you think of there are saw palmetto. Is that one of your typical
That's
go-to?
my first go-to is saw palmetto. It is, it stops that transaction from happening from testosterone to DHT. There's also medications on the market, and I try to explain to patients, I don't really want to go chasing a side effect with a medication. That's not really our goal. We'd really like to do it naturally. So that is really where Dr. Huber and I focus on.
I want to point out this little guy, aromatase. And that's an interesting compound, because we're going to talk in just a second about how awesome testosterone is for breast cancer. And Karen's already humbly admitted her history of breast cancer and her use of testosterone. Well, wait a minute, Karen. If you're taking testosterone, isn't that going to turn into estrogen and drive your breast cancer again?
So again, that is also, some of it's genetically based. Do you have a lot of this aromatase activity or do you not? But either way, it's been shown that in order to keep testosterone from converting to estrogen, you can use a medication or supplements that block that aromatase enzyme and keeps that from happening. Now, this is all probably a second hour of a lecture, webinar we could do. But the real question is, does estrogen really drive breast cancer? We won't talk about that today.
It does not.
Right. And so we're a little bit caught, but we do know that that estradiol can be stimulatory to the breast. So we try and minimize that. And that's really where the benefit comes out for prevention of breast cancer and reducing breast cancer, is adding in an aromatase inhibitor.
Yeah, so that's what we typically do. We give testosterone with anastrozole or letrozole, and that blocks that enzyme so that your breast cancer surgeon doesn't have a heart attack and everybody's happy and we move forward. And the studies that by Glazer have always been with testosterone with anastrozole. So it's really a great combination. I really, again, there were several things I wanted to leave our audience with when they watch this. And number one, getting rid of some of the myth and the mystery around it, and you've done a great job of detailing. But I want patients to walk away with, well, why would I even bother? Why would I take testosterone? And I think this slide kind of points to some of the really important aspects. Our brain, which you've already alluded to. Hey, I'd really like to not get Alzheimer's. This has been shown. Hormones have been shown in general to reduce Alzheimer's risk in men and women. We've already talked about the breast and the fact that testosterone reduces that risk and reduces the risk of recurrence. Muscles and bone. We know that the more muscle I have, the greater my longevity. We know testosterone supports that and supports the bones, as Dr. Kaufman has alluded to. Hey, how about that sagging skin? Isn't that fun? Well, testosterone supports collagen production, so it does help keep. What have you seen with that, Karen? Your experience with testosterone and skin quality?
Women really love that. Now, at a certain point, I think we're all challenged with our low face and some of the jowls we get. Like, I can't act like it's we're going to reverse everything. But women really say, my fine lines look a little bit better. This is with estrogen too, not just testosterone. But for testosterone and the sagging skin, definitely the integrity of the skin. And that kind of speaks to, I think, trying to rewind, not necessarily rewind the clock, but offer some anti-aging options.
Yeah. And then circulation, not a lot of people are thinking about this, but it does stimulate your red blood cell production. And this is an important one. Does anybody want to lose a few pounds? Testosterone, when it's normal, helps with fat burning and weight loss. And close to my heart is my heart. We know that testosterone has a tremendous impact on cardiovascular health and vascular health. So again, those are, if a woman comes in and says, I feel awesome, but if her testosterone is unmeasurable, I'm looking at this picture and thinking, yeah, I know you feel good now, but I don't want you to have a heart attack next year, and I don't want you to get Alzheimer's 5 years from now. So why don't we normalize that? I want to share two cases. This first one was my patient, stage 4 breast cancer. She had a mass alongside her sternum that you could see. You didn't even have to touch it. You could see it. It was that big. She went to a very famous clinic here in Ohio. I won't name it. And they did the right thing. They said, look, you need surgery and radiation and chemo. But bottom line, they scared the living bejeebers out of her. And she came home and didn't do anything because she was so scared by all this. I convinced her eventually to do testosterone pellets with anastrozole. That's the only treatment she took, other than she changed her diet and did some smart things. 3 months after she started with the testosterone pellets, she had a 60 to 70% reduction of the mass of the cancer seen on a PET scan. You could no longer see it just by looking at her chest wall. It had decreased that much. At that point, she gained enough through myself and talking with her oncologist. Let's at least do some radiation. She consented to that. And post-radiation, no surgery, no chemo, her follow-up shows complete resolution. There was no biologic activity of cancer in that chest. Isn't that amazing? Now,
Wow.
again, that's one case. That's not everybody's experience. I want to share one other one. This comes from Dr. Glazer. This is a published paper. This is a 90-year-old female, and she had a almost 2.5 centimeter breast tumor. Now, she was 90, not in the best of health, so she wasn't a surgical candidate. And so they decided instead, they took 3 60-milligram testosterone pellets and just inserted it right into the breast, right around the tumor. 46 days after inserting it, there was a 7-fold reduction in the tumor. And by 13 weeks after the insertion of the pellets, there was a 12-fold reduction in the tumor. So you can't tell me that testosterone doesn't aggressively attack cancer. I think of it as estrogen is a wonderful thing, but it stimulates breast cells. Testosterone is anti-estrogen to some degree, Do you want to speak to that? Because you certainly have personal experience here.
Well, it's very profound. I mean, I think your examples speak for themselves, but to suffice to say, I have complete confidence in using my own testosterone pellet with an aromatase inhibitor. And I share stuff like this with my patients every day.
Yeah. One last thing, neurologically protective. We know that hormones protect our brain, and you and I can go through all the nitpicky biochemistry and physiology, and it's really cool stuff for geeks like us. But I just thought this was a beautiful example. Here's a 65-year-old woman with tremors. Her tremors were so bad, she wouldn't go out to eat at restaurants because her hand shook and she just felt very self-conscious. She got a testosterone pellet. And what you're seeing there, the initial, that's her trying to write her name, okay? Horrible tremors. She got the pellet 2 hours later. 2 hours, folks. You can see at the bottom, her signature is far more legible. Now, think about that impact. 1 pellet insertion, and 2 hours later, she's already functioning better. Think about all the neurologic issues that testosterone could be beneficial for. Your migraines, seizure activity, memory, mood, sleep, anything related to your brain function can be enhanced if testosterone is low and it's effectively treated. So that's pretty much, I think, all we had. I definitely want to take questions. Let me just peek at my window here. We got a few folks with us. Does anybody have a question for Dr. Kaufman or myself about testosterone replacement? So you've been in Colorado for 20 years. You've been doing integrative medicine for how many, and using bioidentical for how many years now?
7. So I started out as a traditional OBGYN And as I mentioned earlier, not having the answers for people. And I really wanted to help people. I went into medicine to help people. And I was starting to feel like, I had a couple of options. And so once I started learning about the hormones and getting a further fellowship education and really feeling complete confidence in that, then it's really transformed, as I'm sure Dr. Huber can attest to patients' lives.
Okay. Well, I don't see that we're getting any questions. We must have not, either we didn't spike any curiosity or we answered them so completely. Either way, it was absolutely delightful to have this conversation. I know that I'm going to be able to point to this conversation with my patients and they're going to get a tremendous benefit from it. I really appreciate your time today, Karen. Beautiful. Your insights, just awesome that you were able to share them with us today. And if anybody has any questions for myself or Dr. Kaufman, there's our contact info. And I would say Dr. Kaufman is open to hear your questions, and oftentimes, absolutely. Yeah, this is such a hot topic. We both know you can't go down the street to your local OB-GYN or your surgeon or your oncologist and have these conversations. They're just not educated.
That's the hard part.
But they're just not there.
Yeah, I once, and Dr. Huber, thank you so much for inviting me. This has been your patients are so fortunate to be a part of your practice, and thank you very much. But I want to just say that that's one of the things I did lecture to Case Western Reserve year 1 medical students about integrative medicine. I was surprised they invited me, but they did. And I was trying to explain that as an OB/GYN, you learn that basically the only parts that matter are from the belly button to the, to the pelvis, and nothing is really connected. And it just, rocked my world wide open to see how everything's connected to everything. So I'll leave it at that.
Very good. Well, thank you, Karen. Greatly appreciate your time. And to the rest of you, again, I really encourage, if there's any questions, please ask. We love to take on those questions. All right.
Thank you so much for having me. Okay, bye.
Take care. Bye now.